What is lung cancer? Lung cancer is a type of cancer that begins in the lungs, typically in the cells lining the air passages. It is characterized by uncontrolled cell growth in the lung tissue, which can form tumors and interfere with normal lung function. There are two main types of lung cancer: non-small cell lung cancer, NSCLC, and small cell lung cancer, SCLC, each with its own characteristics and treatment approaches. As always, these ideas are discussed in more depth in the book Cancer Self-Defense 101, Quick Tips to Help You Survive. All citations for studies quoted in this video can be found in the book's bibliography at cancerselfdefense101.com. This video is intended as information, not medical advice. It is not intended to treat, diagnose, or cure any disease. Any medical advice should come from an appropriately credentialed medical professional familiar with your unique circumstances. Standard of care treatments for lung cancer. The standard of care treatments for lung cancer can vary depending on the type and stage of the cancer, but generally include surgery, surgical removal of the tumor, or in some cases a portion of the lung, lobectomy, may be performed for early-stage lung cancer. Radiation therapy. High-energy rays are used to target and kill cancer cells, either as the primary treatment or in combination with surgery or chemotherapy. Chemotherapy. Anti-cancer drugs are administered either intravenously or orally to kill or slow the growth of cancer cells. Targeted therapies. In NSCLC with specific genetic mutations, targeted therapies like tyrosine kinase inhibitors, TKIs, are used to block the action of specific proteins involved in cancer growth. Immunotherapy. Immune checkpoint inhibitors, such as pembrolizumab and nivolumab, are used to stimulate the immune system's response against cancer cells. There are routinely developments for treatments in lung cancer. One website to see promising medications for lung cancer is onclive.com. Here is a list of some medications commonly used in the treatment of lung cancer. For non-small cell lung cancer, NSCLC, chemotherapy drugs, cisplatin, carboplatin, paclitaxel, docetaxel, gemcitabine targeted therapies, erlotinib, gefitinib, afatinib, lorlatinib, immunotherapies, immune checkpoint inhibitors, pembrolizumab, nivolumab, atezolizumab, durvalumab for small cell lung cancer, SCLC, chemotherapy drugs, etoposide, cisplatin, carboplatin, topotecan, irinotecan immunotherapies, immune checkpoint inhibitors, atezolizumab, durvalumab. It's important to note that treatment plans for lung cancer are highly individualized, and the choice of medications depends on factors such as the type and stage of lung cancer, the presence of specific genetic mutations, and the patient's overall health. Some patients may receive a combination of chemotherapy, targeted therapy, and immunotherapy. Seriousness compared to other cancers. Lung cancer is one of the most serious and deadly types of cancer, often diagnosed at an advanced stage. It is a leading cause of cancer-related deaths worldwide. The seriousness of lung cancer compared to other cancers is reflected in its high mortality rate. Early detection and treatment significantly improve outcomes. Prognosis for Stage 1. Non-small cell lung cancer, Stage 1. Lung cancer is localized to the lung and has not spread to nearby lymph nodes or distant organs. The prognosis for Stage 1 lung cancer is relatively favorable, with a 5-year survival rate of approximately 56% to 73%, depending on the subtype and other factors. Surgical resection is often curative at this stage. Prognosis for Stage 4, non-small cell lung cancer stage. 4 lung cancer is advanced, having spread to distant organs or lymph nodes. The prognosis for Stage 4 lung cancer is less favorable, with a 5-year survival rate typically around 1% to 10%. Treatment focuses on controlling the disease and improving quality of life. The prognosis for small cell lung cancer is worse than non-small cell, with a Stage 1 5-year survival rate of approximately 20% and a Stage 4 survival rate of 5% or less. What are symptoms of developing lung cancer? The symptoms of lung cancer can vary depending on the type of lung cancer, its stage, and individual factors. Some common symptoms that may indicate the development of lung cancer include persistent cough, a chronic cough that doesn't go away or worsens over time, especially if it produces blood or rust-colored sputum. Shortness of breath, difficulty breathing or becoming easily winded, even with minimal physical activity. Chest pain that is constant and may worsen with deep breathing, coughing, or laughing. Hoarseness, a persistent hoarseness or change in voice quality that does not resolve. Unexplained weight loss, significant and unexplained weight loss, often accompanied by loss of appetite. Fatigue, unexplained and persistent fatigue or weakness, frequent infections, repeated lung infections such as bronchitis or pneumonia, wheezing or a whistling sound when breathing, coughing up blood, hemoptysis, which is the coughing up of blood or blood-streaked sputum. Chest or shoulder pain that radiates from the chest to the shoulder or down the arm. Difficulty swallowing, difficulty or pain when swallowing, known as dysphagia, which can occur if the tumor is pressing on the esophagus. Swelling in the face or neck, swelling or enlargement of the face or neck, often due to the involvement of lymph nodes. It's important to note that these symptoms can also be caused by conditions other than lung cancer, and many people with these symptoms do not have lung cancer. However, if you or someone you know experiences any of these symptoms, especially if they are persistent or worsening, it is essential to seek prompt medical evaluation. Promising therapeutics for lung cancer. Ongoing research in lung cancer has led to the development of promising therapeutics, including targeted therapies. New targeted therapies are being developed to address specific genetic mutations and biomarkers in NSCLC, improving treatment options for certain patient groups. Immunotherapies. Ongoing clinical trials are exploring combinations of immunotherapies and other treatments to enhance the immune system's response against lung cancer. Liquid biopsies. Liquid biopsy techniques are being investigated to monitor disease progression and detect genetic changes in lung cancer more effectively. One integrative treatment that is promising against lung cancer is molecular hydrogen, meaning hydrogen gas. This gas can be made by a machine, or it can be made by a tablet that is put into water. It has been found that hydrogen gas accumulates preferentially in the brain and lungs. The benefits of molecular are described in detail in the book Cancer Self-Defense 101, Quick Tips to Help You Survive. Why is lung cancer tricky? Lung cancer is considered tricky for several reasons. Late diagnosis. Lung cancer often presents with symptoms in its advanced stages, making early detection challenging. Aggressiveness. Some types of lung cancer, particularly SCLC, can be highly aggressive and may spread rapidly. Diversity. Lung cancer encompasses various subtypes, NSCLC, SCLC, each with distinct characteristics and treatment approaches. Risk factors. Smoking is a major risk factor for lung cancer, but non-smokers can also develop the disease. Limited treatment options. While progress has been made, advanced stage lung cancer can be difficult to treat, and the prognosis remains poor in many cases. Additionally, the constant movement of the lungs can make targeted radiation difficult, instead necessitating a more general regional radiation. Difference between NSCLC and SCLC non-small cell lung cancer, NSCLC, and small cell lung cancer, SCLC, differ in terms of cell type, behavior, and treatment approaches. NSCLC is the most common type, accounting for about 85% of all lung cancer cases. It includes adenocarcinoma, squamous cell carcinoma, and large cell carcinoma. NSCLC tends to grow more slowly and is often treated with surgery, radiation, chemotherapy, targeted therapies, and immunotherapy. SCLC is less common but more aggressive. It tends to grow rapidly and is often diagnosed at an advanced stage. Treatment typically involves chemotherapy and radiation therapy, as it tends to respond well to these approaches. Immunotherapy is less effective in SCLC compared to NSCLC. In conclusion, lung cancer is a serious disease with a high mortality rate, but treatment options and outcomes vary based on the type and stage of the cancer. Ongoing research aims to improve therapies and detection methods, highlighting the importance of early diagnosis and tailored treatments. For more information, see Cancer Self-Defense 101, Quick Tips to Help You Survive.